My name is Adela Mizrachi. I am the communications specialist at the Institute for Public Health and Medicine. And we're going to be having a panel today, or presentation today by Matthew M. Davis and Marie Heffernan, excuse me. So COVID-19 has had a profound impact on children, adolescents, and families in Chicago. And our guest today will present data from their recently launched Voices of Child Health in Chicago Parent Panel Survey regarding parents' concerns about COVID-19, their intentions to vaccinate themselves and their children against COVID-19, and the impact of the pandemic on their families. The Parent Panel Survey includes perspectives of parents from all 77 community areas in the city to ensure that community views are part of the citywide conversation about child and adolescent health. And today we've got Matthew Davis, who is the founding director of Voices of Child Health in Chicago. He is the chair of the Department of Medicine at Lurie Children's and chair of pediatrics at Northwestern University Feinberg School of Medicine. And he is joined by Marie Heffernan, who is the associate director of Voices of Child Health in Chicago, and she oversees the Voices of Child Health in Chicago Parent Panel Survey and the dissemination of monthly reports on survey data. So I am going to hand it over to Matthew.
Thanks, Adela, for your introduction, and good afternoon, everyone. It's a pleasure for Marie and me to be part of today's IPHAM seminar, and we're looking forward to the conversation that hopefully we'll have after our presentation. Marie and I have prepared an updated version with fresh data as of last week from our parent panel, and we're excited to share that with you and to hopefully extend conversations here on campus about the wellness and health challenges of youth in our city and the families and neighborhoods who are around them. Marie, next slide, please. In today's conversation, we'll begin actually with a level set, if you will, a context of the local and national surveys about health and healthcare among children and adolescents that provide really a landscape view and give us a sense or an opportunity to consider why have we launched Voices of Child Health in Chicago. Then we'll talk a bit about what we're trying to accomplish with Voices of Child Health in Chicago and the parent panel that we'll be presenting today, the goals, the form, and the function. And then Marie will take us through findings from Wave 1 and Wave 2 as we've tried to measure the impact on youth of the COVID-19 pandemic and the socio-environmental adaptations that we've made as a society, as part of policy and as part of the efforts to mitigate transmission of the SARS-2 coronavirus. And at the end, we'll have an opportunity to think about next steps and to welcome your questions. Next slide, please. We're fortunate in the United States and as health services and policy and population health researchers to have many options to consider when trying to measure and better understand health and healthcare for children. We've listed a few on this slide, and we wanted to highlight these because they represent different approaches with different opportunities to ask questions that those of us here in the Northwestern and Lurie Children's communities might want to try to answer. So the first bullet here is the National Inpatient Sample and the Kids Inpatient Database. These are sources of information around hospitalized children, as the names imply, beginning at the national level, where states submit information from their statewide databases regarding admissions of kids to hospital level care, observation, and inpatient length stays. The National Inpatient Sample is released every year, the Kids Inpatient Database at a 3 or 4 year interval, depending on when the funds are available at the Agency for Healthcare Research and Quality. I've had the privilege of working with many scholars over the years on studies that have used the National Inpatient Sample and or the Kids Inpatient Database, and they are in fact national resources that offer benchmark data around patterns of hospital level care. However, you can't identify a child who might be hospitalized more than once at any given time, and overall we're missing population denominators for children in terms of the chronic conditions they may have, or in fact some of the more local details that people might want to look at with regard to environmental conditions or socioeconomic circumstances. So then we take a look at the National Survey of Children's Health. That is, as the name indicates, a household survey of parents and guardians regarding the health of children in their households. This is released also on an intermittent years basis and has undergone some changes over time that can make it challenging to look at survey to survey trends. However, it also continues to be a national resource regarding prevalence estimates for some of the most common childhood chronic conditions, and also some estimates of the changing areas of emphasis and interest for our child health focused research community. For example, the National Survey of Children's Health has served as a resource for estimating the frequency with which children experience adverse childhood experiences. And scholars such as Nia Hurd-Garris here on our campus have used the NSCH, and I know one of our younger faculty members at Lurie Children's, Audrey Brewer, has also used the NSCH to get some estimates of the patterns of ACEs and how they relate to children's health and well-being in other aspects. The NSCH is even more popular in terms of sheer numbers of manuscripts published than the National Inpatient Sample, in part because it includes such things as attitudes and experiences beyond healthcare use per se. The Medical Expenditure Panel Survey then expands on some of these ideas and actually in some ways connects the first two and doesn't only focus on children. The Medical Expenditure Panel Survey, as several members of the audience here may have used, takes a look at household units over 2-year time spans and follows them with regard to some attitudes and experiences, and also more direct, in fact, some gold standard measures of healthcare utilization and expenditures. That makes the MAPPs, as it's affectionately called, another type of resource that can be used to look at family level expenditures and also to focus in on child focused or child level health and healthcare. It is stronger in my experience on the utilization than it is on the conditions. And in fact, some of the estimates of chronic conditions that you might get from the National Survey of Children's Health don't show up in the MAPPs as often as you'd expect them to. And that is one of the shortcomings of the MAPPs with regard to children's health. It tends to be better in my experience for adult specific conditions than for child specific ones. The relative pros and cons of the first three here led my colleagues and me at University of Michigan back in 2006 to start another effort, the National Poll on Children's Health. That continues to this day and is a national household sample of families across the United States from, in a given survey wave, at least 48, if not all 50 states in the District of Columbia, to present a truly national view with at least 2,000 respondents in about every survey wave. It's now, I believe, on survey wave number 33 or 34. The National Poll on Children's Health is designed to be able to pivot to news of the day or news of the year, at least, in terms of areas of concern that are expressed by the public, and is meant to be driven by those concerns in terms of its areas of emphasis and focus. In addition, it's designed to be a multi-user platform where we can welcome in investigators whose areas of expertise in particular subject matter areas of emphasis can be brought to bear on developing and fielding survey questions that then can feed back to those particular subject matter areas. That's a way of building it out beyond some of the more commonly asked questions in the top 3 survey types or database types here, and also has served as a way to provide physician investigators and research investigators with information they've used in, for example, NIH applications or foundation applications for their work, and has also led to over 40 peer-reviewed publications over the last 12 years or so. So with those experiences in that context, a couple years ago, we decided to start something that we call Voices of Child Health in Chicago. The idea is to take the National Poll on Children's Health model that is driven to a large extent by the interests and concerns of the public, and to focus it in on the city of Chicago and the children who live here. The context for Voices of Child Health in Chicago was immediately recognized by the Chicago Department of Public Health, which, as part of conversations when I was just getting started here 4.5 years ago, alerted us that they had something called the Healthy Chicago Survey that they fielded each year via telephone and had served as a benchmark resource for them in measuring progress towards what they call their Healthy Chicago goals. They were delighted at CDPH to have the opportunity to team up with us on what we call Healthy Chicago Survey Junior, which are additional modules that are fielded to respondents to Healthy Chicago Survey who have one or more children under age 18 living in the household. It's important to emphasize that each of these different approaches highlights or facilitates investigations into child health and healthcare and attitudes at the community or family level regarding children's health and healthcare in different ways. The rule of thumb is there is no perfect data source regarding these issues, and the goal here is to elevate the parental or the guardian voice, the voices of individuals for whom child health and healthcare are extraordinarily important on a regular basis into the routine conversation here in the city of Chicago. The first couple years of Voices of Child Health in Chicago involved putting out a regular series of reports on a monthly basis, initially based on data collection from the Healthy Chicago Survey Junior in tandem with the Chicago Department of Public Health. Subsequently, Marie Heffernan and our team and I were fortunate to get some philanthropic funding that allowed us to build a parent panel. So in the next couple slides, I'll describe that panel, and then Marie's going to take us through some of our early findings. Next slide, please. Our Voices of Child Health in Chicago effort, as I mentioned, is really focused on surveying Chicagoans to better understand the issues that impact youth health in our city. By design, we have respondents from all 77 community areas. This is meant to be as inclusive as it can be. Of note, there are efforts besides Healthy Chicago Survey that have been carried out in the city. For example, our friends at the Sinai Urban Health Institute focus on they actually do a door-to-door survey in 4 community areas that are right around the North Lawndale neighborhood where most of the patients at Sinai come from. So it's not the only one, but we believe it is the only one focused on youth health and is the only one drawing respondents from all 77 community areas. Next slide, please. Our parent panel, as you see with the focus above, is recruited by mail through a survey partner. We work with the National Opinion Research Center, or NORC, at the University of Chicago, and individuals must have at least one child under age 18 years in the household. They can choose to complete each survey online or via phone if they prefer, and we administer it in English and in Spanish. Next slide, please. Our design is to have 3 surveys fielded per year on a variety of topics. And this follows the pattern then of the National Poll on Children's Health that I shared earlier, because it allows us to focus on a wide variety of topics and to be as timely as possible. I would never say that we built a survey for a pandemic, but in fact, having a nimble survey that we could field on a regular basis about pandemic issues has turned out to be enormously helpful to us as we try to assess how the pandemic is affecting children, adolescents, and their families here in the city. We are, through serial administrations of the same types of modules, also able to repeat questions longitudinally, and you'll see some of that today in terms of how we try to leverage that to understand trends over time. You see here the 2 waves that we've fielded so far. The first in May and July last year, after the pandemic had started and we'd already had the first stay-at-home order. And then beginning in November, as the neighborhoods were opening up, some schools felt bold enough to go back to in-person learning, and we wrapped up data collection here in February. All analyses you're going to see here today are population and response weighted to reflect the overall census patterns of the city of Chicago. It's important for us to acknowledge the extraordinary help and insights provided by our Voices of Child Health in Chicago Governance Committee, who are experts here at Lurie Children's and Northwestern, and also in CDPH with the areas of expertise that you see listed here. We depend on this governance committee to make certain that we are responding to concerns that are either established or emerging here in the city regarding youth health and healthcare. Now I'm going to turn over to Marie Heffernan, who's going to start taking us through aspects of the parent panel's Wave 1 and Wave 2. Marie, over to you.
Thank you, Matt. Hello, everyone. I'm Marie, and my pronouns are she, her. Today, we'll talk about analyses from data collected in the first and second waves of the parent panel survey. And on the screen, I have the sample demographics from wave 1 and wave 2 of the survey. So in wave 1, we had over 1,600 parents who completed the survey, and there were over 2,800 children who were represented in the surveyed households. In wave 2, we had over 1,500 parents who completed the survey, and there were over 2,600 children represented in surveyed households. I also have the weighted breakdowns for race and ethnicity. The data are weighted to represent the population of Chicago at the time of data collection. So we had 39% Latinx, 22% non-Latinx Black parents, 30% non-Latinx white parents, and 9% multiracial or other race parents. So as we have talked about already, parents, children, and families in Chicago have faced unprecedented challenges during the COVID-19 pandemic. Families have had to adapt to drastically different routines and new concerns about their health and well-being. And we wanted to survey Chicago parents about their attitudes and experiences during the pandemic to understand how the pandemic is affecting Chicago children and families. So we asked about 4 overarching topics. First, about parents' concern about COVID-19 and their trust in COVID-19 information coming from different sources. We also asked about COVID-19 vaccination intentions and about the pandemic's impact on children's mental and physical health. And finally, we asked some questions about remote learning as well. So we'll first talk about parents' concern about COVID-19 and their trust in COVID-19 information sources. To assess this, we asked parents 2 questions. First, we asked, how concerned are you about coronavirus or COVID-19 affecting your family's health? And how much confidence do you have in information about coronavirus or COVID-19 from the following sources? Chicago parents were quite concerned about COVID. During wave 1 of the survey, which remember was May to July 2020, 64% of parents said that they were very concerned about COVID-19 affecting their family. 31% said they were somewhat concerned, and only 5% of parents said that they were not concerned. And the proportion of Chicago parents who were concerned was higher than the proportion of US adults who were very concerned during that same time period. Only 49% of adults said that they were very concerned. Later in the pandemic, from November 2020 to February 2021, the proportion of parents who were very concerned shifted slightly. At this time point, 57% of parents said that they were very concerned, 36% said they were somewhat concerned, and 7% said they were not concerned. This was a significantly lower level of concern from wave 1 to wave 2. However, Chicago parents were still more concerned than US adults overall at this time point as well. There were some differences in concern levels by demographics, and I'll go over some of these differences that reached statistical significance at p is less than 0.05. So in the heat map on the screen, on the top level, we have the level of concern that ranged from not concerned to very concerned. And then each row represents responses from parents of different race and ethnicities. We see that non-Latinx Black parents were the most likely to report being very concerned about COVID-19. 75% said that they were very concerned, followed by Latinx parents, and then multi-race or other race parents, and non-Latinx white parents. In wave 2, we see a similar pattern. However, during this time point, Latinx parents were the most likely to report being very concerned about COVID-19. 63% said they were very concerned, followed by non-Latinx Black parents, multi-race or other race parents, and non-Latinx white parents. We also see a shift here to decrease levels of concern among non-Latinx Black parents. So in wave 2, 59% of non-Latinx Black parents said that they were very concerned, whereas in wave 1, that was 75% of non-Latinx Black parents who were very concerned. In the US and in Chicago, the COVID-19 pandemic has disproportionately affected communities of color due to structural racism. Other research has shown that factors that contribute to increased risk among people of color include limited access to culturally competent healthcare, lack of access to transportation, and challenges taking time off of work. In Chicago, we know that the majority of cases of COVID-19 and the majority of deaths related to COVID-19 have occurred among Latinx and non-Latinx Black populations. So we see in our data that parents' concerns about COVID reflect this disproportionate impact of the pandemic. Concern about COVID-19 also differed by household income. Parents who were in the middle income range, so 100 to 399% of the federal poverty line, were most likely to be concerned, most likely to say that they were very concerned. So 72% said they were very concerned, followed by parents with household income below the FPL, 64% said they were very concerned. And then those with the highest household income were the least likely to say that they were very concerned, with only 53% saying they were very concerned. And this same pattern emerged again in wave 2. And parents with low to middle income may be less likely to be able to telework than parents with higher income. It's also known that essential workers face higher risk of COVID-19 infections than others. Next, we examined which COVID-19 information sources parents had the most confidence in. So in this figure, the darker blue dots represent the proportion of parents who said they had lots of confidence in each information source. The teal dots or lighter blue dots were the proportion of parents who said that they had some confidence, and the green dots were the proportion of parents who said they had little to no confidence in each information source. And then each row represents a different information source. So we saw that parents were most confident in information from doctors, with about 60% of parents saying they had lots of confidence in information from their own and their child's doctor. About 50% of parents had lots of confidence in information from hospitals and from public health websites. 25% of parents had lots of confidence in news, both on TV and online. And only 16% of parents had lots of confidence in information that came from social media. This pattern of confidence in different information sources was consistent in wave 2 as well, with slightly lower levels of confidence across the board. We saw that parents had the most confidence in information from doctors, including their child's doctor. But we also noted that parents' confidence in information from their child's doctor varied depending on the parent's education level. So here in the lighter blue are the parents who had lots of confidence in their child's doctor. In the medium shade of blue are the parents who had some confidence, and the darker shade of blue are the parents who had little or no confidence. So you can see that parents with a college degree or higher were more likely to have lots of confidence in COVID-19 information from their child's doctor, about 70%, compared with parents who had some college or some technical school, those with a high school education or below. Closer to 55% of those parents had lots of confidence in information coming from a child's doctor. Next, we'll go over parents' intentions to get a COVID vaccine for themselves and for their kids. So we ask parents, how likely would you be to get yourself and or your child vaccinated against COVID-19 if a vaccine were available? When we ask parents about their likelihood of getting a COVID vaccine for their child during wave 1, 49% were very likely, 19% were somewhat likely, 16% were not likely, and another 16% were not sure. We asked the same question again in wave 2 of the survey. At this time point, from November 2020 through February of 2021, 38% of parents said they were very likely to get a COVID vaccine for their child, 24% were somewhat likely, and 22% were not likely, and 16% were not sure. So compared with wave 1, you can see that the proportion of parents who were very likely to vaccinate their children decreased, and the proportion of parents who were somewhat likely or not likely to vaccinate their kids increased. And these changes were significantly different from wave 1 to wave 2. The proportions in wave 2 of intention to vaccinate kids are similar to a recent national survey that found approximately 42% of parents at a national level say they plan to vaccinate their children. In terms of parents' intentions to get a vaccine themselves, in wave 1, these proportions were actually identical to the percentages for intentions to vaccinate their children. So 49% of parents were very likely to get a vaccine for themselves if one were available, 19% were somewhat likely, and 16% were not likely or not, and another 16% were not sure. And parents' intentions to vaccinate themselves and their children were closely associated. For instance, 94% of parents who were very likely to get a vaccine for themselves were also very likely to get a vaccine for their children. These rates at wave 1 for the Chicago parents' intentions to get vaccinated themselves were similar to national COVID-19 vaccination intention rates for adults in the US at that same time period. In wave 2, parents had slightly lower intentions to get a COVID vaccine for themselves, but this was not statistically significant. The difference was not statistically significant from wave 1. At wave 2, the proportion of parents in our survey who were either very likely or somewhat likely to get a COVID vaccine, which was 66% in total, the two shades of blue there. And that was pretty similar to the rate nationally of people who had either already received at least one dose of the vaccine or who were very or somewhat likely to get a vaccine when one was available. So what we see when looking at these data is that parents' intentions to vaccinate themselves haven't changed significantly over the last several months. However, we see that parents' intentions to vaccinate their children have decreased significantly. And this is cause for concern for child and adolescent health in Chicago, and something that we hope to understand better in our work in future waves of our survey. And we hope to explore ways to reduce parents' vaccine hesitancy around the COVID vaccine for their children. There were some differences in COVID-19 vaccination plans by demographic vectors. In wave 1, when we explored COVID vaccination plans by parent race and ethnicity, we saw that multi-race or other race parents and non-Latinx white parents were the most likely to say that they would get a COVID vaccine for their children, followed by Latinx parents, and least likely were non-Latinx Black parents. The pattern of results was similar from wave 1 to wave 2. However, in wave 2 of our survey, we see a decreased likelihood of vaccinating children among Latinx parents and among multi-race or other race parents. The shift from wave 1 to wave 2 was significant and was largely driven by a decrease among multi-race or other race parents who said that they were very likely, and then a corresponding increase in the proportion of multi-race or other race parents who said that they were somewhat likely to vaccinate their children for this population. And it was also driven by a decrease among Latinx parents who said that they were very likely, and a corresponding increase in the proportion of Latinx parents who said that they were not likely to vaccinate their children. In both waves of the survey, we see that among communities of color, where we see the highest level of concern about COVID-19 for their family's health, we also see a lower likelihood of getting a COVID vaccine for their children. And we know that the historical context of medical research in the US has led to a distrust of medical research among communities of color. This distrust is justifiable, and it's important that we in public health and in medicine continue to work to build that trust. Parents' likelihood of getting a COVID vaccine for their children also was associated with parents' age. 55% of parents who were 46 years of age or older said that they were very likely to get a COVID vaccine for their children, followed by 48% of parents aged 26 to 45, and only 23% of younger parents aged 18 to 25 said that they were very likely to get a COVID vaccine for their children. Parents likely, the same pattern of likelihood occurred in wave 2, although with lower overall levels of parents who were very likely to vaccinate their children. The lower likelihood of vaccination among younger parents maps onto some of our previous survey work on flu vaccination rates that showed that younger parents were less likely to vaccinate their children against the flu than older parents were. One topic that clinicians and the public have been very concerned about is the impact of the pandemic on youth mental and physical health. To learn more about this, we asked parents about their access to mental and behavioral health care for their children and about mental and physical health symptoms. First, I wanted to give you a little bit of background about the landscape of youth mental and behavioral health in Chicago. This topic is of particular concern because data from recent years suggests increasing incidence of mental and behavioral health issues among Chicago youth. For instance, discharge data from the Illinois Department of Public Health shown here indicates that the number of mood and depressive disorder hospitalizations for youth and emerging adults in Chicago has been increasing over the last decade plus. Moving back to our survey data, we asked parents about the mental and behavioral health care that they have sought for their children during the pandemic. We found that 31% of parents had talked with their child's primary care doctor about mental or behavioral health concerns for their children within the last 6 months. And another 17% of parents had talked about this with their child's provider within the last year. So that's nearly half of the parents in our sample who had discussed mental health concerns for their child with their child's provider within the last year. 24% of parents had used specialty mental or behavioral health services for their child within the last year. And 18% of parents said there had been a time when they could not get mental or behavioral health services that they wanted to get for their child. We explored the issue of mental health care access in a little bit more detail. And for the parents who said they could not get mental health care for their child, we asked about the barriers to getting this care for their child. The most common reasons were that it was difficult to find a provider. 52% of parents said that it was difficult to find a provider, that it costs too much. 44% of parents said that, and that they could not get an appointment in a timely fashion. 40% of parents said that as well. Additionally, 24% of parents said that they did not know where to go for these services, and another 10% said they could not get their children to go for the services. And 8% of parents said other, and we had a free response text box for the other response, and a lot of these responses had to do with insurance not covering mental and behavioral health services. We also asked parents of younger children aged 2 to 11 whether their children had experienced any behavioral symptoms or physical symptoms that can be connected to behavioral and mental health. 23% of the younger children in our sampled households had more tantrums compared with before the pandemic. 19% of kids were displaying more clinginess than before the pandemic. 11% had nightmares or sleep disturbances. And other symptoms included headaches, stomach pains, bathroom accidents, and difficulty getting along with other kids. In total, 43% of children aged 2 to 11 in the surveyed households experienced at least one of these behavioral health symptoms. If we map that proportion onto the population of children in Chicago who are between the ages of 2 and 11, that represents approximately 72,000 young children who are experiencing mental or behavioral health symptoms in the city. We also found that these symptoms were more likely among children in families with higher income compared with lower income. Another question that we asked parents was about how their children's activities during the pandemic compared with before the pandemic. So here in the light blue is the proportion of children who are doing each activity less than before. The medium shade of blue is the proportion of children who are doing each activity the same amount as before. And the darker blue is the proportion of children who are doing each activity more than before. So kids are doing some things less than before. They are hanging out with friends in person less. 81% of kids are doing this less than they were before the pandemic. And this makes sense given remote learning and cancellation of some youth activities and restrictions on gathering. Another 72% of kids are spending less time outside, and 49% are doing less physical activity. There are other things that children are doing more of. So they're spending more time with friends remotely. 46% are spending more time with their friends remotely. 27% of kids are eating more. And they are spending more time using screens, both for educational and non-educational purposes. This pattern may be cause for concern about the continued effects of the pandemic on youth mental health and on physical health issues such as childhood obesity. Since this data is brand new, our next step with this kind of data is to start to connect the dots to understand associations between experiencing mental health symptoms and the activities that children have or have not been able to do. The last topic that we'll cover today is about families' experiences with remote learning. The pandemic and the shift to remote learning in Chicago and across the country has radically shifted how children have been learning over the last year. During the pandemic, public schools in Chicago went to full remote learning until just recently when some schools started to open up for hybrid learning. So it makes sense that the majority of the children in our sample, 84%, were in full remote learning, with much smaller proportions in full in-person learning and hybrid learning. We asked parents how they would rate their children's experiences with remote learning. And based on parents' reports, the majority of children had a positive or very positive experience with remote learning. This did not differ by child age or by grade level. We also asked parents how concerned they were about various school-related issues during COVID-19. In the light blue is the proportion of parents who were not concerned. In the medium shade of blue is the proportion of parents who were somewhat concerned about each issue. And the darker blue is the proportion of parents who were very concerned. So you can see that parents were more concerned about their child or family members getting sick if school were in person. About 50% of parents said they were very concerned about both of those issues. And they tended to be more concerned about that than about their children falling behind in school or in social skills. Around 30% of parents were concerned about both of those issues. This was somewhat surprising to me because in a recent national survey, US parents said that their children were learning less during the pandemic compared with before. In that same national poll, however, 67% of all respondents, these were either parents or students themselves, said that they were somewhat or very concerned about K through 12 education during the pandemic. And that number is actually pretty close to the proportion of parents in our survey who were either very or somewhat concerned about kids falling behind in school, 69%. We also wanted to know how parents were managing remote learning and childcare during the pandemic. Over half of parents said that this was very easy or easy. 33% said that it was difficult, and 13% said that it was very difficult. When we explored this by parent gender, moms were more likely to say that this was difficult or very difficult than dads were. We also wanted to get a sense of how much time parents were spending doing childcare and homeschooling activities each day. Most parents of school-age kids were doing between 1 to 7 hours of childcare or school at home activities each day. And there was also a difference here by gender. Dads were more likely to report spending 1 to 7 hours on childcare or remote learning, so those kind of middle range values, whereas moms were more likely to report the extreme ends of the scale, either many more hours or fewer hours. So I wanted to leave you today with a few takeaways from the data that I've shared with you. Chicago parents are quite concerned about the pandemic affecting their families' health. This concern has decreased a little bit over time, and this concern also differed by demographics. The differences that we see in concern by race and ethnicity speak to differential burden of illness and stress that communities of color are facing because of the pandemic. And I think it's important to be sensitive to this differential experience of stress related to the pandemic. During the pandemic, behavioral health symptoms have increased for young children, and access to behavioral health care remains an issue for many families in Chicago. Parents report generally positive remote learning experiences for their children, but a high daily burden of childcare and educational supervision. As I mentioned before, Voices of Child Health is continuing to collect data related to COVID-19, and we're also collecting data, and we have forthcoming data on a variety of other topics as well. These topics include things like swimming and water safety, adverse childhood experiences, firearm safety, parent attitudes about the use of artificial intelligence in medicine, and infant sleep practices. So here's our contact information. If you have questions or if you're interested in collaborating, please do reach out to us. You also have our website up there, lurie-children's.org/voices, where you can download our monthly reports and sign up for our listserv. And I have listed the rest of our Voices team as well, without whom this work would not be possible. And so before we turn it over for questions, Matt, I wanted to see if you had any final thoughts before opening it up for questions.
Thanks, Marie. And as you can see, what we've tried to do here over waves 1 and 2 is help the broader community here be aware of parents' perspectives, have a chance to see either the stability or the changes of those perspectives over time with respect to one of or some of the largest or greatest concerns expressed by families related to the pandemic and to behavioral health. But we also are engaging in several other topics, as Marie just introduced in the previous slide. And that gets back to the goal here of having Voices of Child Health in Chicago serve as a common platform for multiple investigators and their teams to get involved. We've designed this not as something that's only for us on this team, but rather something that's meant to be a shared resource for the Lurie Children's and Northwestern communities to really dig in here. We would add that as we know that IPHAM has a lot of researchers who focus chiefly on adult health and healthcare issues. We really welcome you to think about how the dynamics of adults' health and healthcare and their attitudes and practices may intersect with what's going on for youth healthcare and health and attitudes as well in that family and neighborhood environment. Those are not very frequently addressed questions in the worlds of health services and population health research, but we believe, and perhaps you do as well, that they're very worthy questions to try to understand, and that may serve as the areas of emphasis for future interventions as well here in our city. That really benefits, I think, when we lift up local voices and can understand better how to shape our interventions in ways that are very community engaged. So we've seen some questions come through, and we'll turn it back now to Adela to moderate the discussion.
Yes, thank you so much. This was really enlightening. Before we go to some of the questions, I just wanted to let everybody know that if you have any questions, you can use the Q&A panel at the bottom. Don't use the chat. We won't be monitoring that for questions. However, in the chat, I did also, and I will do it again, just in case, I'm sharing a link so that you can subscribe to the Voices of Child Health in Chicago newsletter. So that's there for you right there. And also, I know there was a question about sharing the slides, so I will work with the presenters to see if they're willing. But regardless, we are recording this webinar and we'll post it and also email everybody who is here with the link to the recorded presentation. So on to the question. So Jeff had a question that was very similar to my question, which is what was the exact wording of the question about vaccination for kids? So could the differing results over time be a result of realizing the reality of the availability or approval of COVID vaccines for children?
Thanks, Jeff, for that question. And Marie, perhaps you could back up the slides to the actual wording we use there.
Yeah.
What I'm going to going to paraphrase and say that we had to write it as a hypothetical, right? Because there weren't any indications for vaccination against COVID-19. In fact, there were no even EUA or emergency use authorization vaccines approved at the time we fielded wave 1. So here it was, how likely would you be to get yourself and or your child vaccinated against COVID-19 if a vaccine were available? And we maintained exactly that wording for wave 2. It turns out it's not, in wave 2, it was much more about available supplies of approved vaccines, whereas wave 1 was actually even having a vaccine that would be effective against COVID-19. But we felt that the hypothetical framing was still appropriate. Now, I don't know about you, but as something becomes more real, I think I would anticipate that interest in the public might increase. But here what we seem to be seeing instead is that parents are showing more hesitancy or more reluctance to vaccinate their children and adolescents over time against COVID-19. Typically, when we would see at a population level a decrease in interest of prevention, it's because the threat of the illness that would be prevented is perceived as going down. So we need to understand better why parents are saying they might be less interested. Certainly, as Marie illustrated, we are seeing, essentially from wave 1 to wave 2, the same frequency of hesitancy among our Black and African American patients, an increase in hesitancy among Latinx parents, and an increase in hesitancy among the other non-Latinx parents as well.
So Jonathan is asking if there's any insights regarding the effects of having had COVID and or knowing a close friend or family with COVID infection on the intention to vaccinate themselves or their children.
John, what a great question. Marie, I don't believe we fielded that question in this survey, but we did field it in another survey of Lurie Children's patients.
That's correct.
Yeah, so we had a separate sample where we drew from our entire patient panel about 4,000 families. We sent it to about 10,000 families, about 4,000 responded. This was back in May. And already by May, we saw a stark difference in the experiences of families with respect to COVID-19 illness and COVID-19 related mortality for African-American and Black Chicagoan families and Latinx families versus non-Latinx white and non-Latinx other families. At that time, for the Lurie Children's patient panel, we did not ask about vaccination. It goes to show you, even within our own organization, we haven't managed to find exactly the right combination of questions to field in each survey. There are always tough decisions to make between the cost of fielding surveys and the number of questions you can include. But that's a great question, John. Thank you.
Great. So Nick is asking, do you have any recommended resources or services for parents to help their children suffering from mental health challenges, specifically anxiety, that may be related to the pandemic?
Thank you, Nick. Yes, we do. Some of you may be familiar with a wonderful program we have at Lurie Children's called the Center for Childhood Resilience. So if you go over to that web page, right near the top, underneath the banner, there's a call out there for resources related to helping families and youth during the COVID-19 pandemic. And that has a lot of what you're seeking there that you mentioned in your question. The Center for Childhood Resilience is also a frequent resource for school systems, for the city, for public health interventions in general. And there are other very worthy units at our sister institutions throughout the city focused on kids that have put forward some resources and curated them on their websites too. The Center for Childhood Resilience happens to be the Lurie Children's version of that approach.
Thank you. And I posted the link in the chat for those of you who want to go there now. So with regard to finding that behavioral health symptoms were more likely among children and families with higher income, I'm wondering whether there has been any comparison done with the same question pre-pandemic. wondering if perhaps those behavioral health symptoms are more common to low-income households to where they have not seen an increase since they've always been there, or if there are other confounding factors such as parents in higher income households potentially being home more this past year and maybe they have just noticed the behaviors that they didn't notice previously.
Yeah, I think those are two great explanations, potential explanations. Unfortunately, we don't have data collected pre-pandemic to use as a comparison for that item. But I think that those two explanations are possibly what's going on there. Matt, do you have anything to add to that?
Thanks, Marie. I would suggest to Anonymous that there may be other national resources, for example, the National Survey of Children's Health, that has baseline pre-pandemic measures of behavioral health and wellness for youth. And as NSCH is then fielded again, or if there are perhaps other survey teams that have fielded questions using exactly the same question as the National Survey of Children's Health, that perhaps there would be an opportunity there for comparison. Excellent questions.
Great, so we've got a question. Do you have any metrics based on political affiliation?
Marie?
We do not ask about political affiliation. I know that there are other surveys that do ask about political affiliation and that also ask about intent to vaccinate and to examine how that differs by political affiliation. But in our survey, we don't ask parents about their political affiliation.
I would like data on mental health concerns of parents, depression, anxiety, grief, anger, suicidal ideation, etc., with regard to their children. I think that's more of a comment, so.
Yes, from my point of view, one of the best resources at the national level about those measures would be the Behavioral Risk Factor Surveillance System, BRFSS, which is a state-specific but nationally based platform run through the CDC. Some attendees here may be familiar with the BRFSS, and also its cousin, or perhaps its kid, the YRBS, the Youth Risk Behavior System. So BRFSS and YRBS are two resources that are broadly available. It's mostly publicly available data. There are some data that are available. You set up a more in-depth relationship with the CDC. And also importantly, states can choose to field their own questions in those platforms that are specific to concerns of state level stakeholders. I happen to have found out through mentoring a fellow here on campus that there's enormous expertise in ISGEM, the Institute for Sexual and Gender Minorities, focused on YRBS. So please head over to ISGEM if you'd like to work with some very talented team members with regard to the YRBS.
Yes, and the YRBS data, you can also examine some of the years specifically for Chicago. So they have some local estimates for Chicago, and that is collected every 2 years, YRBS. But in the off years, there's another survey called the Illinois Youth Survey, IYS, which asks a lot of the either exact same or very similar questions related to depressive symptoms, suicidal ideation, things like that. So that would be another source for comparison.
Thank you. And I posted the link to ISGEM in the chat. Susanna is asking, health disparities researchers are turning away from the concept of trust and toward the concept of trustworthiness, emphasizing how the healthcare system and its providers have responsibility to be equitable and trustworthy. How might your data be used or new data be collected to amplify the importance of providers and systems to be trustworthy?
Thanks, Susanna. I guess we might conceptualize that as trust is what you have between people, and trustworthiness is a characteristic of a particular individual or institution. So thank you very much for asking this. I think you're right that a platform like ours
Uh-oh, we might have lost audio there for a second.
And other similar survey-based platforms might be used to explore regard to vaccine hesitancy. I'm back?
Yeah, you're back.
Okay. I just wanted to thank Susanna for bringing up this. I just wanted to thank Susanna for bringing up this difference between trust, which is something that occurs between people, and trustworthiness, which is a characteristic of somebody or an institution. And you're right that survey platforms like this could be an effective way to look at that distinction and also try to understand how different information campaigns could be used to help build trustworthiness or senses of trustworthiness, and also build trust relationships between different groups and people. I think now's the time to focus on it regarding vaccine hesitancy. And I saw an earlier comment here, I think, about NU Catalyst, who's working on some messaging around vaccine hesitancy related to COVID-19.
So Bonnie wants to know, has information about vaccine safety and efficacy in children been published and widely dispersed? My understanding at the moment is that clinical trials are still ongoing for adolescents.
That's right. Clinical trials are ongoing for 12 and over. And then at Lurie Children's, we are going to be a site for clinical trials that will also be taking a look at COVID-19 vaccine for under 12 years, perhaps even as young as 6 months old.
So Judith has a comment. She says, perhaps you should also take into account the influence of the anti-vaccination movement on the hesitancy of parents getting their children vaccinated. I recently interviewed a woman for a study I'm conducting on perinatal health in Chicago. The participant, who already has a child, told me her child was not vaccinated at all. She cited narratives often associated with the anti-vaccination movement, namely the idea that vaccination can cause autism and other illnesses. The influence of the anti-vaccination movement, I think, is an important factor to consider.
Yeah, I think that is a great point. And one thing that we did see in our data, and I don't think I mentioned this, was that parents' intentions to get a COVID vaccine for their child, if one were available, were associated with whether they got their child a flu vaccination in the previous year. So if a parent did not get their child a flu vaccination in the previous year, they were less likely to say that they would get their child a COVID-19 vaccine. And so I think the anti-vax movement and connection with vaccine hesitancy is something we definitely will want to consider in our work.
Okay, so I'm going to ask one final question and then we'll wrap up. So Anonymous is curious about some of the free response answers you collected about behavioral health. Were there any challenges mentioned around decreased access to school-based health centers during the pandemic?
Ooh, that's a great question. Decrease access to school-based health. So we did not, I have not seen that yet, but as we mentioned before, these data are kind of hot off the presses. So we're still going through it in detail. And I think that's something that we will explore. We did have some questions about using school-based health services or school-based services for mental and behavioral health and for additional learning services, things like that. But they were not necessarily specific to pandemic times, just kind of in general. So we do have some data on that, not necessarily free response, but I imagine we also have free response text about that as well. That will be kind of exciting to go through soon.
Great. Well, I want to thank you both so much for doing this today. This was really enlightening. And thank everybody for coming. I've posted a couple of links for you to subscribe to the bulletin, upcoming events, and we hope to see you again soon. Thank you.
Thank you.
Thanks for having us.